One of the hardest questions we have to answer is, what do dental implants cost? Because everybody's situation is different, it could range anywhere from a few $1,000s to $60,000. The factors that we need to think about are we doing a mini implant or are we doing a two-stage implant? Now, clinically, what determines which one we do is how much bone you have, whether you have enough bone width-wise and height-wise. So there are different kinds of implants, and the technology is constantly changing. I imagine in time that's even going to change. But that's two different variables right there. Now, with the two-stage implants, the bigger ones, the stronger ones, those also require an abutment, or the part that joins into the implant, which replaces your natural tooth structure, what would be from the gums up, so that a crown could be put on top. Now, so you have the implant, that is one price. You have an abutment, which is another price, or a connector. Then you have the final crown on top. Now, that's the option for a single tooth replacement. Now, there are different qualities of crowns too, anything from solid zirconia that's unbreakable to porcelain to metal, and there are other options based on your budget and what you want and expect. Now, that's the single tooth replacement. From that, there are people that say, all right, well, I'm missing 2 teeth in a row or 3 teeth. And for that, we could do an implant bridge. So it would be similar to a bridge, like a bridge goes over from land over water to land. You go from implant over your gums to the next implant, and you could have a 3-tooth bridge, for example, or a 4-tooth bridge. And that would involve 2 implants, 2 connectors, and 3 or 4 crowns on top. That's a different price. Some people may have multiple teeth missing in the back and only have front teeth. Well, for them, they could have a partial denture, which would be one piece and comes in and comes out, and that could be attached on 2 or 4 implants. That's one situation. Another situation that may be you, which is a very common one, is people that come in that have a full denture and they say, can you do it on 2 implants? Sure we can. That's going to be less money or less of an investment than do it on 4 implants or 6 implants. But the decision of how many implants to do, whether 2, 4, or 6, can be dependent on where you have bone and how much bone you have, because quite frankly, sometimes people will come in and say, I want to do 6 implants, but we have to say you only have enough bone to do 4. So that's going to determine, because you only pay for what you get. And it's like anything else in life. You get what you pay for. And so that's another scenario. Now, there's another scenario such that somebody comes in and says, I have a very bad gag reflex. I do not want a plate, even if it's held in by implants, it goes across the roof of my mouth. Well, a plate can be made that's simply shaped like a horseshoe that does not cover the roof of your mouth at all. That way you can feel more natural to your tongue, your tasting is better, your speech is better because you don't have that interfering with your tongue. So that's another factor that plays into the overall cost of what a dental reconstruction would be. There are some people that come in and say, you know what? I want teeth just like the ones I was born with, except I want them straight, I want them white, I want it to be awesome. I want to have that smile I've always dreamed of. And that's the Cadillac of dentistry. That's the very best. That's the Comfort Lock implant bridge. That's having the solid zirconia that you can control whether you want to come out at all or if you want to take it out daily just for great hygienic maintenance. So those are a lot of the things that you have to think about when it comes to what is a dental reconstruction going to cost. So it basically boils down to you. What do you want? What can you have done based on what's inside your mouth and what's within affordability comfortably for you? And those are all the factors that you need to think about.